How's it going? I'm BrandHugh, your local Medicare agent. If you've ever felt confused about Medicare, what's Part A, what's Part B, and what in the world is Part C, hey, you're not alone. In this short video, I'm going to break down each part of Medicare in plain English so you can feel confident about your coverage options. So let's dive right in. So looking at this sheet here that I have up here, we have four parts of Medicare. You have Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D. All right, starting with the first one, Medicare Part A, that's hospital. I like to call that room and board. Okay, think of it as hospital coverage. It helps pay for inpatient hospital stays, skilled nursing facilities, hospice, and some home health care. Most people, they don't pay a premium for Medicare Part A, for that Part A. All right, next up we have Part B, doctor slash outpatient. I like to call this one outpatient care. It covers outpatient care like doctor visits, lab work, preventative service, and some durable medical equipment. The catch is there is a premium for Part B. Most people pay somewhere around $175, and I believe that's going up in 2026. You know, Moving on, you have Part C. I call this all-in-one advantage plan. This is private companies. So this is, when you look at private insurance companies, we're looking at United Healthcare, Blue Cross, Aetna, etc. But it's also called Medicare Advantage. And what it does, it bundles parts A and B, and it also includes extra benefits like dental, vision, hearing, gym memberships, and sometimes over-the-counter cards, to pay for healthy foods and things like that. And so what it does, instead of the government paying your bills directly, Medicare pays an insurance company like your United Healthcare, Blue Cross Blue Shield, Aetna, to handle your care. And so that's Medicare Part C. Diving deeper into it as we're moving along, we're talking about Part D, and that's drug coverage. And I like to call that standalone prescription drug coverage. You know, you can get a standalone plan along with your original Medicare, or it's usually built into a Medicare Advantage plan. So you can have parts A and B and add D, and that'll take care of your drug costs, or you can have A and B and go with a Medicare Advantage plan, and D sometimes is also included into that. As we continue to scroll down, so as I was saying before, just so you can know kind of like what it covers, you have A, which covers, your inpatient hospital care, skilled nursing, hospice, limited home health. It's provided by the federal government, and we like to call that original Medicare. And we're talking about Part A. Some of the keynotes to take away from that is usually no monthly premium. And if you pay Medicare taxes while working, you're not going to have to worry about a premium with that. Going on down to Part B, this is just a quick overview. This is medical insurance, and that covers your doctor's visits, outpatient care, preventative services, lab work, medical equipment. It provides, also by the federal government as well. And with these two together, we call them original Medicare. The monthly premium is around $175. And then as we go down to Part C, we call that Medicare Advantage. And what it does is combines A and B. Sometimes it includes drug D, prescription drug plan. It's usually called a PDP, and it has dental, vision, hearing, etc. And those are provided by private insurance companies, as we're talking about United Healthcare, Blue Cross Blue Shield, Aetna, Humana, etc. It acts as an alternative to your original Medicare, but it may include extra perks. And then finally, we get to Part D, which is prescription drug coverage, and it helps pay for prescription medications. Those are also, private insurance company approved by Medicare. It can be a standalone with parts A and B, or a lot of times they can be included with your Part C, and that'd be called an MAPD, Medicare Advantage prescription drug plan attached to it. That's pretty much the Medicare parts A through D made simple. If you enjoyed this video, just put a like and subscribe down at the bottom. But it will be more videos coming along with this as we go into this series of Medicare 101 made simple. Enjoy the rest of your day. God is good.